hospice care. Hospice is a philosophy. It is not, a lot of times people think of hospice and they think they have to go somewhere to a hospice facility or something like that. That's not the case. Hospice is a philosophy of care. It's provided in the home, whether that's a nursing home, assisted living, independent living, a group home, any place like that, wherever that individual calls home. And optimal outcomes is if it's at home and they're surrounded by loving support from family members or caregivers or friends. Now, the difference between palliative care or palliative medicine and hospice is that palliative medicine is not the same. Those words, some people like to use interchangeably, and they run a real fine line. Because palliative has only grown more popular, I guess you can say, here within the last 2 years. And so Medicare and healthcare and those powers to be are looking at palliative care more closely. But what palliative medicine is provided at any age with any stage of a serious illness. It can be offered at the same time that you're being cared for, where like you're getting chemotherapy, you're waiting on a liver transplant, radiation. So you still can seek aggressive type treatment while you're on palliative. Palliative mainly is, maybe a nurse, a physician monitoring the situation to make sure you're comfortable while you go through these things. And it's available regardless of life expectancy. Now, what hospice care is that patients who are diagnosed with a terminal illness that physicians say has 6 months or less for the prognosis and no longer seeking curative treatment. So, with that being said, what that means is that two physicians has to certify hospice. They have to reasonably believe, based on the assessment gathered, their information, the labs and things like that a patient has 6 months or less to live. I will tell you now, that is not always the case, okay? We have patients that have been on hospice upwards of 2 years, whether that's consecutively or they were on hospice maybe 8 months, disease process stabilized out, and they got better. Now, with additional care, that does happen to where disease process stabilize out, meaning that their appetite is still intact, they're not really losing weight, they're not having infections, they're not falling, their mobility and activity, weakness level has improved or is here instead of a decline. So we can discharge, and we call that graduating hospice. So, but a physician has to certify that based on what they believe that reasonably that they will pass away. Now, what Medicare and the system has is that they have what we call benefit periods. You have a 90-day benefit period, and at the end of that, they look at everything to research the patient to see if they're still eligible. They go another 90 days. They look at the information, see if they're still eligible, meaning they still have a little tiny decline. Then after that, you have 60-day benefit periods, unlimited. What they have to do, a physician then or nurse practitioner goes out to the patient's home or via telehealth now since COVID, and assesses the patient to make sure that they're still eligible for hospice. If not, they do plan of care discharge. At any point, if a patient starts to decline again, a nurse can go back out, they get a physician's order, can go back, reevaluate, and the patient can come back on hospice. So that's the difference between palliative care and hospice. And I will be talking a bit more about hospice as well. Now, one of the main questions we get is the cost. Who pays for it? Hospice is provided by paid for primarily or predominantly by Medicare. No charge to the patient or their families. Medicare, Medicaid, private insurances like if you have Blue Cross, Blue Shield, United Health, Ambetter, Superior, all those guys, if it is in your plan for those private insurances, a lot of times they cover about 80% of hospice, and then the other 20% is supposed to be out of pocket. But hospices in the United States, understand, most people don't have that 20% to pay, and so hospice basically waives that, and the insurance pays the 80%. Generally, hospice is about $200 a day per day. So, like I said, a lot of people are not in a position to pay, $40, $50 a day all month or for 6 months, whatever type of thing. So, what's included in there? Hospice pays for, and this is the benefit that I see greatly for hospice. The number one benefit that I think for hospice is the education piece. Because again, if I tell you based on the disease process of what I see as a nurse going out, what's most likely to happen, and for instance, if I say, okay, you're at this stage and have a little bit of shortness of breath, if they have more, you have oxygen available, it's on 2 liters. You have the ability to turn it up to 4 if they get into distress. This is what distress will look like. So if it happens, they have the hospice is 24/7 nurse availability. So if I get a call at 2 in the morning, I can either go out, or if I'm educated on medications, I can tell them what to give and how much to give. So that's the great piece of it too, is the education portion of it. It prepares family members a lot more for when that time does come, because you taught them the whole way of, if they're declining, what to expect. So hospice covers medications related to the terminal diagnosis. Hospice covers supplies, which we see the great benefit, because that includes the diapers, the briefs, the wipes, the gloves, things like that. Wound care supplies, we see a lot of wounds. And it also covers DME, or durable medical equipment, which is your hospital bed, your wheelchairs, bedside tables, bedside commodes, shower chairs. Hospice pays and covers for all of that. And when it's delivered, the DME company also will go over how to use it and so forth. So it's continual education, and that's the big piece I tell people when I'm doing an admission. Don't feel like you have to know all of this, at once, because I'm gonna be with you every step of the way, or the nurses in the field, other nurses, and we're gonna explain anytime you have questions. So the main thing is making sure family members, patients, caregivers don't feel alone in the journey.